Robin Sen. I'm a lecturer in social work, and I've worked as a social worker in Scotland, as well as a lecturer in England and Scotland. And I want to add my voice in support of Terry and in support of the motion today. Having worked in both countries, I'm aware that there's significant differences in the care system between England and Scotland, but many of the experiences we know of care experienced people between the two countries are the same. And we know that outcomes have been stubbornly poor for care experienced people over a number of years. A recent large-scale study by the University College London, conducted with data from the 1970s to the 2010s, showed that care experienced people experience premature death rates of up to two times the rates of those who are not care experienced. They also found, concerningly, that the rate of difference between care experienced people and non-care experienced people had risen over time, so more recently got greater. We know that some people have very positive experiences of the care system and go on to do very well, Terry being a shining example of that. We also know that there are committed social workers, carers, teachers, housing workers, community workers and people in the community. But we know that despite that, systemically, the outcomes for care experienced people are poor. The reasons for that are complex, we know, and we know that this motion is not a panacea that will solve all of them. But this is a concrete, practical step that the Council can take today to make a step in the right direction to provide better systemic support and better systemic identification of the barriers and putting in place solutions that will help care experienced people. I want to finish on this, Council. The most far-reaching decision that a social worker can take on behalf of the state is removing a child from their birth family. When we take on that, there is a huge moral responsibility on us all to try to ensure that the experiences of that child throughout their lifetime, not just in childhood, are better than they would have been had they remained in their birth family. This is a concrete, practical step that can be taken today by the Council to ensure that we start to look at ways in which that can be true for all care experienced people in Edinburgh. I hope